How can we tackle antimicrobial resistance? Well, you must be thinking, what is antimicrobial resistance? Antimicrobials come in the form of antibiotics, antifungals, antivirals, and antiprotozoal drugs. They are used to treat infections caused by harmful bacteria, fungi, viruses, and protozoa by killing them or stopping their growth. The overuse and misuse of them have increased the ability of microbes to resist the effects of antimicrobials, making them ineffective for treating infections in animals as well as humans. The spread of AMR has resulted in increased mortality rates, prolonged hospital stays, and has increased healthcare costs. If the problem isn't addressed, it is estimated by 2050, 10 million people will die due to AMR per year. This is why it's a global concern. So how can we reduce the spread of AMR? Well, one way is improving infection prevention. Reducing the spread of infections can help decrease the transmission rate of infectious diseases. This can be done by improving hygiene levels in healthcare settings, such as good hand hygiene and an effective infection control plan. This is important as healthcare settings are a high-risk environment for the spread of infections. Another way is to expand the access of clean water and sanitation infrastructure, especially in low- and middle-income countries. The reduction of infection will reduce the need for treatment and ultimately reduce the amount of antimicrobials being prescribed. Another way is to reduce the amount of unnecessary use of antimicrobials in agriculture. Antimicrobials are used to treat infections, used prophylactically, and for the promotion of growth in livestock animals. Antimicrobials are not fully metabolized and are excreted from animals, which then enter the environment, which increases the spread of AMR. Reducing unnecessary antimicrobial usage for prophylaxis and growth promotion can help reduce the spread of AMR. Restrictions on highly critical antibiotics in agriculture that is used in humans can also help reduce the spread of AMR. Promoting new rapid diagnostic tests is another intervention that can help tackle the antimicrobial crisis. Rapid diagnostic tests can reduce unnecessary prescriptions, optimize treatment, and improve doctors' confidence when prescribing antimicrobials. It can do this by allowing doctors to know if the infection is viral or bacterial. This will ensure that antibiotics are given to those who need them. It can also allow doctors to ensure that the correct antibiotic is being prescribed with the right dose and duration. This will reduce the number of unnecessary antimicrobials being prescribed and will make existing antimicrobials be effective for longer. In the future, with more funding, rapid diagnostics could test for resistance, which would further help optimize treatment. Vaccines and alternative therapies are another method that can help reduce the spread of antimicrobial resistance. Vaccines are an effective tool against AMR. Existing vaccines should be used more widely as they can prevent and reduce infectious diseases, they reduce antimicrobial resistant infections, and they indirectly reduce appropriate and inappropriate antimicrobial usage by reducing the overall infectious incidence, which include viral infections which antibiotics are mistakenly prescribed to. Future vaccines could target multi-drug resistant infections, which could reduce the spread of antimicrobial resistance. Using alternative therapies instead of antibiotics can help reduce the spread of antimicrobial resistant strains. An example of an alternative therapy is antibodies. They can be used to target bacteria and prevent them from causing a disease. More research is needed in the area of vaccines and alternative therapy. Global awareness and global surveillance are required to help tackle antimicrobial resistance. Public awareness campaigns focusing on the detrimental impact AMR has on modern-day medicine has the ability to reduce antimicrobial consumption and slow down the spread of resistance. Education campaigns can bring behavioural changes which can help farmers and patients to reduce their demand and help clinicians to reduce unnecessary antimicrobial prescriptions. Awareness campaigns can be very cost-effective. Global surveillance is required as it can improve patient health, provide early detection of the spread of antimicrobial resistant strains, and it can provide early warning of emerging threats. Different policymakers and organisations such as the Global Antimicrobial Resistance Surveillance System, as well as the government, need to collaborate together to improve global surveillance networks and ensure there is enough funding to maintain it. Overall, these are some methods that can be used to help tackle the antimicrobial crisis. They can help slow down the resistance to antimicrobials, as well as this, they can help preserve the effectiveness of antimicrobials for the future generation.